Good afternoon, everyone. Welcome. This is our third session today in the transition from your present health benefit plan to the state health benefit plan. Today we will answer all your questions. If anyone has a cell phone, we're being recorded. It would be possible to just put it on vibrate or shut it off just for the hour so there's no back noise on the recording. By way of introductions, I'm Dominic Snelly from Brown & Brown Insurance. We are the consultants for the City of Paterson in handling this transition to the State Health Benefit Plan. You're going to be introduced to Susan Frey from Horizon, Mary Carr from Aetna, and Bill Buckwich from Optum RX. Those are the three plan designs that you'll be taking a look at. As you know, on September 25th, the City Council voted to transition to the State Health Benefit Plan effective January 1, 2019. This was largely based on a reduction of costs compared to the current plan, and in turn, it affects each and every one of the employees because their Chapter 78 contributions will be a major savings going forward in 19. All full-time employees now have the opportunity to choose from 8 different medical plans from either Horizon Blue Cross Blue Shield, Aetna, and with prescription drug covered through Optum RX. Your dental coverage will not change. It will remain the same. All plan options are being offered at a reduced cost to employees compared to your current plan. So depending on which plan design you decide to go into, either the Direct 10 or the Direct 15 or any of the Aetna plans, you'll see the cost comparisons to what you're paying now. We also, on the website, there is a Chapter 78 calculator, which you could put in your present salary and the plan design that you wanted to obtain, and it will give you an idea what your options will be. All employees must complete the enrollment forms, and they should be back to the city no later than October 31st. We are here today to give you an entire overview of the plans and what's available to you. If anyone has individual questions dealing with a personal medical issue or any of your spouses, just come up after the meeting. We'll be happy to answer those questions. We have done it on 2 previous sessions here, and it's gone very smoothly. And if you have any questions on the application, Gary will be able to answer them for you. So right now I'll turn it over to Susan from Horizon.
Thank you, Dominic. Hi, everyone. My name is Susan Frey. I'm from Horizon Blue Cross Blue Shield of New Jersey. And when I come out to do these presentations, I first start off with an overview of the enrollment process on behalf of the New Jersey Division of Pension and Benefits. So hopefully everyone has come and picked up a packet of information as you entered. If you have not done so yet, please do so. And again, for those people who have entered late, please set your phones or radios to vibrate. Thank you. This session is being recorded. So let's start off with that application that was in the packet that you received when you first entered. The application form, Section 1, is the information about you, the employee, your Social Security number, name, date of birth, etc. And then Section 2 is your employment status. Section 3 is asking you for the reason for application, and you're going to check off new enrollment. Section 4 is for the level of coverage, so here you'll indicate where you are either taking single coverage, parent-child, family coverage, etc., and also check off, most typically, the health and RX box. But if you wanted to just take the health plan or just take the prescription, you could do that, but under normal circumstances, most people check off both boxes. Now, if you're waiving coverage, you're going to check off in box 3, waiver of coverage, and also indicate below that, I have been offered the above coverage and elect to waive. So if you're waiving coverage, you're completing this application, and you're also going to complete another form, which is the waiver of coverage form. So both the application and the waiver form need to be completed if you're waiving coverage. You'll also include a photocopy of proof of the other coverage, perhaps through a spouse. Section 5 is the health plan that you're choosing. And you'll see that you have a large number of choices between Aetna and Horizon. And for prescription, it's not indicated on here, but when you take a medical plan and you check the RX box, then you'll have your prescription drug through Optum RX. And more will come later in the presentation about the prescription drug plan. So you have a large number of plans available to you because, as Dominic pointed out earlier, the amount that comes out of your paycheck is based upon the premium of the plan. And some of these plans have a high premium and others a lower premium. And so you want to take a look at all the options available to you. Section 6 is the dependent information. Dependent information in Section 6, you're indicating if you're covering dependents, their names, dates of birth, social security number, etc. And when you're covering a dependent, you also need to include some required dependent documentation. So if you're covering just yourself, then all you need is this application form. But if you're covering a spouse, you need to include a photocopy of your marriage certificate and a photocopy of your 2017 1040. Just the top of page 1, the non-financial information. The marriage certificate says to the state, well, you got married 20 years ago, but the 1040 says you're still married, essentially. So the state is looking on that 1040 for your names, you and your spouse, at least the last 4 digits of your social security number, your address, and also the filing status, that which says married filing separately or married filing jointly. For children, you're going to include a photocopy of the child's birth certificate, which includes 2 important pieces of information: the age of the child and also whether you or your spouse are the parent of that child. Now, if you don't have the type of documentation that I was just referring to, please feel free to talk to us after the presentation, and we can help you understand what the New Jersey Division of Pension and Benefits would accept in your specific situation. And then, of course, Section 7 at the bottom, employee signature and date. This is one of the most commonly forgotten parts of the application. Don't forget to sign and date your application. And those applications are due to Gary or to his office by October 31st. But if you have them available today and you want Gary to take it, he will put it in his box of applications that he's collecting today. But October 31st is the deadline for submitting your application. And it's important that if you are a benefits eligible employee, that you do submit an application even if you're waiving coverage, because it protects your right to get back into benefits at a later point in time if you perhaps lose that other coverage. All right, so who's eligible? Well, you are as a benefit eligible employee, and your spouse or civil union partner, and your children are covered all the way up until the end of the calendar year that they turn 26. Past that point, a child can go on to COBRA coverage, or they can go on to what's called Chapter 375 coverage that allows a child who is single, no dependents of their own, and lives in the state of New Jersey or is a full-time student outside of New Jersey to have coverage. It's a little bit less expensive than COBRA, so it may be an option you want to look at, and it would cover them all the way up until the age of 31 if they qualify, of course. Now, a question had come up earlier about spouses who maybe work here at the city, both you and your spouse work here. You can't be covered twice under state health benefits program or school employee health benefits program. So what you'd want to do is consider your spouse, whether they work here or maybe for a local board of ed or maybe the state of New Jersey or another local government entity that's in state health benefits. And if they have the state health benefits and you have the option now of state health benefits, you want to consider what's in your best interest. Do you want to take single coverage, or maybe take family coverage and the other person waives the coverage? Those would be your options, but you can't be covered twice. Now, if your spouse works for Joe's Plumbing you know, or for Ace Hardware, or for Target, or ShopRite, what have you. That's not state health benefits. And so you can be covered there and be covered here. That is acceptable. Again, if you have any questions about your specific circumstances, feel free to see us after the presentation. Now, you're going through open enrollment, a special open enrollment right now, to join into state health benefits for January 1st. And next year, during the month of October, you'll be given another opportunity to look at your benefits. You can change plans, you can waive coverage, reinstate coverage, you can add dependents, term dependents. Those are the things you can do during open enrollment, the month of October. But you'll also have an opportunity that if you have a life event, you get married, have a baby, adopt, you lose coverage, and maybe right now you're going to waive coverage. You can apply for coverage for that new dependent of yours within 60 days from the date of event. And the coverage will be retroactive back to the date of the event so that there's no gap in coverage. Make sure, though, that you submit the application to Gary's office so that that application is received on a timely basis, because otherwise you'll have to wait until the next open enrollment period. There's a lot of great information on the state's website. If you go right now to nj.gov/OE for open enrollment, right now the whole state health benefits program is going through regular open enrollment. So there's a lot of great resource information on that website. You can go there, and of course, we have links in all of the materials that we've provided, so you can go there as well. Now, the NJ Wellness Program is something that's going to be available to you as an active employee, regardless of whether you take an Aetna or a Horizon Blue Cross Blue Shield plan. Under the NJ Wellness Program, you, as an active employee, and your spouse or partner who's covered under the plan, you're eligible for a $250 Visa gift card every NJ Well year. All you have to do is a few activities to get 800 points in the program, and then they will mail you or send to you via email an NJ Well gift card for $250. So if you've got a spouse that is also participating in that, $500, which is great. Children are not eligible for that program. Any questions about enrolling into the program before I start talking about specifically about the Horizon Blue Cross Blue Shield plans? Okay, yes. So there's a question about transitioning into being a retiree and the coverage under that. There are going to be retiree sessions this Friday at the Crown Plaza, and then next week there will be additional sessions for retirees. Otherwise, please see us after the presentation and we can talk further about transitioning. But right now we're talking about the active employee benefits. Okay. All right, so let's go into the blue folder, Horizon Blue Cross Blue Shield folder, and you'll see right at the front there we've got our member services number, which is a dedicated phone number for state health benefit program members, as well as the website horizonblue.com/SHBP. If you call this number before January 1st, because maybe you want to ask, is chiropractic covered under the plan? And yes, it is. But if you wanted to ask a question of them, when you call that number, they will ask you for your ID number. And if you put that number in, it's going to kind of like switch you over to your current plan. So if you're asking a question about state health benefits, the NJ Direct plan most notably, if you're asking a question about that, what you'll want to do is say, I'm going to ask you a question about NJ Direct. And that way they can switch you over back to the state health benefits section, okay? Because when you put in your ID number, it knows what plan you're in. It doesn't know that you're thinking about a different plan, okay? All right, inside here you'll also find the plans that are available to you from Horizon, and there's also our doctor finder on this website. So if you want to look to see if your doctor is in the network where you're going to pay a lot less when you receive services than using an out-of-network provider, use our doctor and hospital finder on that website. And again, you can call member services as well. You'll also see a section on this page that talks about prescription drug coverage, so it can take you to the Division of Pension and Benefits website. And Bill from Optum, who's right behind me, he's going to be talking later, and he'll give you some additional websites to look at so you can find out about the State Health Benefit Prescription Plan. Inside, further, we find information about Optum, the tiered network plan that's available through Horizon, as well as the PPO-based NJ Direct plans and an HMO plan. In the middle, and this is where we really get to the heart of the matter, this is a comparison chart of all the Horizon Blue Cross Blue Shield plans that are available to you. There's a wide variety of plans, all right? You're going to see in blue the NJ Direct plans. These plans are going to have over 1.3 million providers nationwide, and in fact, we even have 1.3 million providers nationwide, and then we even have providers that are outside of the United States that are in network in all of these plans that are in blue. The NJ Direct 10 and NJ Direct 15 plans are the most popular plans. 85% of everyone enrolled in state health benefits is in the NJ Direct 10 or 15 plan. But that doesn't mean that you need to select one of those plans. There's a large number of plans there. The NJ Direct 10 plan, and as well as the Aetna Freedom 10 plan, those plans, the premium is going to be the highest, so you're going to pay more out of your paycheck. As you go across the columns, you're going to find that it costs you less out of your paycheck with those plans, but you're going to pay more when you go receive services. So you'll want to take a look at a few options at least to see what's in your family's best interest. So let's start off with the NJ Direct 10 so that I can make sure you have a baseline understanding of the plan. The NJ Direct 10 plan has a $10 office visit copay when you receive in-network benefits, $10 for primary, specialist, urgent care, $75 for emergency room, and it's $25 emergency room for children under 19. You also have certain services that you're going to pay 10% for. You'll see in that column it says 10%, and it's footnoted down here in footnote number 3. You'll pay, instead of a flat $10, you're going to pay 10% of the cost of those services, which are durable medical equipment, prosthetics, private duty nursing, and ambulance. So think CPAP equipment, oxygen, wheelchair, that kind of stuff. You're going to pay 10% out of your pocket. And if all those 10% out of your pocket add up to the $400 out-of-pocket maximum, that's the most you're going to pay. You don't pay 10% anymore. You pay 0% for the rest of the year. We're going to cover it 100%. And in that NJ Direct 10 plan, it's such a rich benefit that even your $10 office visit copays are going to contribute to that $400 out-of-pocket maximum. That's for an individual. If you have a spouse or one child covered under the plan with you, they also would be $400. If you've got 3 or more people covered under the plan, then it's a $1,000 maximum. But if you individually hit your $400 out of your pocket, then your benefits will pay at 100% in network, and they'll continue to pay their 10% and $10 until perhaps they meet their $400 or $1,000 as a family. You also have out-of-network benefits available under the NJ Direct plans. You'll see that you've got a $100 deductible, so if you want to see Dr. Smith, who's not in the network, you can see Dr. Smith, but it's going to be a $100 deductible, and then you're going to pay 20% of the reasonable and customary amount, plus anything that's above the reasonable and customary amount. All right? And that's why I say it's always best to use in-network providers, because an out-of-network provider, one who's not contracted with us, an out-of-network provider can charge you anything that they want to, and you're responsible for that amount that's above that reasonable and customary amount. All right, so there's a lot of plans here. I'm going to skip over to the 2030 just so that we make sure that we understand the differences between plans. Under the 2030 plan, the NJ Direct 2030, you're going to pay $20 for primary, $30 for specialist, but children would still be $20 for specialist. It's a $125 emergency room copay, and it's 10% still for those footnoted items of durable medical, prosthetics, private duty nursing, and ambulance. On an out-of-network basis, you're going to pay a $200 deductible plus 30% of the reasonable and customary amount, again, plus anything that's above reasonable and customary. So you may ask yourself, why? Why would I go into the 20/30 plan when I have to pay more when I go see the doctor? Well, it's because it's going to cost you less out of your paycheck. So it's very important that you understand how much is coming out of your paycheck for any one of these plans and how much is coming out of your pocket as you receive services. So you want to take those two things into consideration. Also, I didn't mention it earlier, but you're going to find that the Horizon and Aetna plans are identical in terms of copays, coinsurance, deductibles, the services that are covered, the services that are not covered. Those things are all going to be the same. The difference is going to be in which providers are in the network. I know most of you are in a Horizon plan today, so if you're using a lot of out-of-network providers, either please start using in-network providers or consider whether your out-of-network providers are instead in the Aetna plan, because you may be more benefited by using in-network providers under your plan. So take a look. Protect you and your family financially. Make sure that you've got the best level of coverage and not paying too much out of your paycheck as well. We do have the Omnia plan, which is a tiered network plan. This plan is like a hybrid between a PPO and an HMO, because you'll see down here there's no out-of-network benefit when you use that or when you enroll into the Omnia plan. You have two tiers of benefits when you do use an in-network provider. In New Jersey, we have 23,000 providers that are Tier 1, where you're going to pay a low copay, $5 for primary, $15 for specialist. Tier 2, we've got another 13,000 providers in New Jersey, plus those 1.3 million providers nationwide who are Tier 2. So you would be paying, though, more. You'd be paying $20 for primary, $30 for specialist, and $1,500 deductible if you have hospitalization or surgery. So consider that as an option. You'll save, though, as you can see, about 25 to 29% out of your paycheck by going into an Omnia plan or a tiered network plan. You also have an HMO plan that's available to you as well. For Horizon, the provider network, like I said, the benefits are going to be the same as what you've got under an Aetna HMO plan, but for the Horizon HMO plan, that is a provider network that's in New Jersey and the contiguous counties outside of New Jersey. So if you are looking for nationwide HMO providers, you'd be better off in an Aetna HMO. But again, all of those NJ Direct plans, nationwide plans, 1.3 million providers. 96% of all hospitals nationwide are in our plan. 91% of all doctors nationwide are in our plan for NJ Direct. All right, we're going to skip over a page now. And you'll see that there's information here about NJ Well, which I told you about earlier, that's available from both Horizon and Aetna. And you can go to that website and find out more information about NJ Well. Skip over one more page, and you'll see there's a section here, and it gives you information for Horizon's contribution calculator. When you go to the contribution calculator on our website, which is horizonblue.com/SHBP, click on the Education Center and then Contribution Calculator. It'll ask what type of employer you have. You would say local government, not state, not local education, local government. That's very important because that way it comes up with the right plan choices for you. Then it will ask you what level of coverage, single, family, etc., and what's your annual base pay. Then you'll select 3 plans to compare. So maybe you put in the Omnia plan, the NJ Direct 10, the NJ Direct 2030. It will ask you then what prescription option. It'll be the first prescription option, which is the SHBP prescription drug plan. And then say compare. And it will tell you then how much will come out of your paycheck over the course of a year for each of those 3 plans, so that you can see, are you going to save $50 a year by going from one plan to another? Are you going to save $500? Are you going to save $2,000? And yes, you could save $2,000 by going from one plan to another plan. So take a look and see how much is going to come out of your paycheck for any particular plan that you may be interested in, and see what makes financial sense for you and your family. Any questions about the Horizon Blue Cross Blue Shield plans? And then I'm going to turn it over to Aetna. Yes? Which plan? So the question is asking for more clarification on the coinsurance out-of-pocket maximum. So you'll see on your plan comparison chart, coinsurance for the NJ Direct 10 and 15 plan, for example, is 10%. And so anything that's a percentage is coinsurance. A copay is a flat dollar amount like $10, all right? So for coinsurance out-of-pocket maximum means that for all those 10%, if they add up to $400 in this case for the NJ Direct 10 or the NJ Direct 15 plan, then you pay $0 for the rest of the year. The plan is going to pay the balance for the rest of the year for those services. And then there's an overall out-of-pocket, a total out-of-pocket maximum, which includes copays and coinsurance and deductibles. So when all of those in-network $10 copays and 10% coinsurance, when it adds up to $400 under the NJ Direct 10 plan, then you don't have to pay the $10 copay anymore for the rest of the year when you go see a doctor, or any of those 10% for durable medical equipment, as an example. Any other questions for Horizon? Okay, thank you. So Mary's going to come up.
Thank you, Susan. Thank you, everybody, for coming today. I know this is a tough decision to make, but Aetna and Horizon were competitors. Like if you're going out to buy a car, if you're going to buy a Toyota or a Honda or a Ford, this is the same thing. You have to do your homework and research to see what plan you like to be in, and look at the cost for the plans and the copays for the plans or the coinsurance. We offer the same plans, we just call them different. If you look at our plans at a glance in the middle, I'll start with that. But Aetna has over 1.2 million providers in New Jersey. Also, starting January 2019, you could go to get blood work at Quest or LabCorp for 2019. Right now, we're just partnered with Quest, but in January, you can go to Quest or LabCorp to get your blood work done. Also, we have our custom website, Aetna State NJ. It's at the bottom of the brochure, and our dedicated customer service team, where you can call and they would answer your questions. If you go to the Aetna State NJ website, we have a custom provider search where you can go there and click on that to see what doctors are in the network for you. So when you open up the plans at a glance, we have our Liberty plan, which is the tiered in-network plan. So the tier 1 providers we have in New Jersey, and we also have providers and hospitals in southeastern PA and Metro New York. And then the tier 2 is our nationwide network all over the US. That's an open access plan, so you do not need referrals to see the doctors. Then we have our HMO plan, which is a gated plan where you need a referral to see a specialist. Then we have our high deductible value plans, where what that means is you're going to be paying more out of your pocket first, so you're paying a higher deductible up front, and then your premium will be cheaper because you're help balancing the cost of the share of your health care. Then we have our Freedom 10, the Freedom 15, the Freedom 1525, the Freedom 2030, and the 2035. All the plans are the same like with cars. They all run the same, but the plans, they just have the differences are the co-pays for the plans, each either the $10 or you could do the 2035 or the 2030. It's just a different cost with the co-pays for the plans, but they all cover the same benefits. So when you're looking at plans, you should look at your family history right now. How many times have you gone to see the provider this year? If your family's on maintenance medication or you have any sicknesses, so that can help you determine what type of plan you like to choose, because then you can look at the premium costs to see which plans are better or more affordable for you to use. Also, wellness is covered at 100%. You should go get your routine physical once a year, and you do not have to pay a copay, and women can go get their gynecological exams once a year as preventative service each year also. And if you need to calculate your costs, you can go to the Division of Pension websites. They have a calculator there that will help you figure out the cost. Next, I just want to talk about the NJ Well program that's offered by the state, where you would earn a $250 gift card for you as an employee and your spouse. You would earn 800 points. First, you would do a biometric screening where you'd take your blood pressure and your glucose levels, and then you would fill out a health assessment online. For Aetna, it's at Active Health, and Horizon has Blue 365. And the health assessment just asks questions about your sleeping patterns, your eating, and you can earn 100 points. Then if you get your routine physical, you can earn 25 points. There's online coaching for smoking and eating, and you can earn 25 to 100 points. And once you earn the 800 points, then you can earn the $250 gift card. Also at Aetna, we have discount programs. We have a vision discount program where you show your ID card. You can get a discount on glasses or contact lenses at LensCraft or Pearl Vision or other providers. We have discounts for gym memberships. We also have a 24-hour nurse line, so if you have a procedure done and you have questions about it and you forget to ask the doctor, you can call the nurse line and they'll be able to explain the procedures and the codes that you're getting done. With Aetna and Horizon, you will be getting an ID card either from Aetna or Horizon, and you'll be getting a separate ID card for Optum. Anybody have any questions about Aetna? Yes? The question was about chiropractor coverage between Aetna and Horizon. It is the same for both plans. So whatever copay you have for the specialist, that would be you would pay for the chiropractic. That's our discount programs where you can get an additional discount if the provider doesn't take insurance. You're welcome. Does anybody else have any questions? Everybody ready for RX? We have Bill coming up.
Thank you. I am Bill Buckrick from Optum RX. We administer the State Health Benefits Prescription Program. Hopefully in your packet you got this little page. We're going to really be concerned with the two boxes on the top before your plan becomes effective, which is when you can do your research ahead of time, look things up, get questions answered you want, and then after it becomes effective. A lot of things. The website you can go to right now, you want to check on what the copay levels are on the medications you take. What is covered under state health benefits is going to be the same across all the RX. What changes is what your copays are. So depending on which medical plan you choose, Aetna or Horizon, and then which level within the 8 plans, the more that comes out of your, more you pay in premiums, the less you pay in copays, and it's also the same for RX. It will set your copay levels. A couple things with the state health benefits. You can go, with the exception of one plan, the 2035 plans, where they tell you on maintenance medications, 2 fills at a retail pharmacy, and then you would be mailing away. That would be mandatory on the 2035 alone. All the other plans, you can go wherever you'd like to. 98+% of pharmacies are in our network. You also can go home delivery if you so choose, because you want the convenience and the cost savings. There's an additional cost savings going through home delivery for maintenance medications. A couple things people are concerned about when you're going into, what do I need to do for January 1st? You're going to get, like they said, you're going to get a medical ID card from Horizon or Aetna, and you're going to get prescription cards from Optum. What you need to do, if you use your local pharmacy, you just need to stop by with the new card, let them take the information down, they put it in their system, you let them know it's for January, you're good to go. The prescriptions you have at your local pharmacy, whether that's the local independent, the CVS, the Walgreens, the supermarket, whoever, they're still there. Unless your prescription expires or runs out of refills, you don't need to go specifically get new prescriptions for January. They're still there. You'll be able to just give them the card. If you currently use home delivery for maintenance medications on your present plan, those you will need to get new prescriptions sent in from your doctor to Optum after January 1st, and then you'll go about setting that up and getting that taken care of. You're going to get 2 ID cards. Some people will already be concerned. It's January. I've got a kid going away to college. What do I do? After January 1, you could order new cards. Easier would be take out your phone, snap a picture front and back, and text it to them. The likelihood is they're going to lose it if you give them the card. They'll lose everything else. So you could just keep it. All they need is that picture. They don't need a physical card. They just need the information on it. The pharmacy will be fine wherever they are. If anyone has any questions about things they currently take and they want to ask them, we can do that once we're done on the side. They don't want to do this in the open forum. If you have any general questions about prescription coverage now. One of the things the state does do is they're going to, in their plans, when there is a generic available, a brand name has a generic, without a medical exception, you need to take the generic drug. Preference, you can still, if you prefer brand names, you can still get the brand name, but the state will charge you the difference in the cost of the two. Which means if one was $10 and one was $100, if it's not a medical necessity, they're going to add that $90 cost to you. The state will not pay it. If there is a medical necessity, you would just go through the process to file the appeal. The doctor would then be contacted and provide documentation, probably, and testing and results to prove the medical necessity of the brand over the generic. Yes? What are they? I don't know what you're doing now. I think in Direct 10 they're going to be 3 and 10. That's per month. So a generic would be $3 a month under the 10 plans. And if you, that same generic, if it was a maintenance drug, would be $5 from home delivery. Yes? Okay. So the question is on a prescription, if it's, how do they determine the copays? The copays are determined per 30-day supply. Quantity and how often you use it. If it's 90 at 1 a day, 3 months, it's 3 copays at retail. So it's copay per month supply up to 90 at retail. It's 1 copay from home delivery. So if it was a generic, be $9, 3 $3 copays. Home delivery, it would be $5 for the complete 90. Home delivery on maintenance medications will save you money. A brand name drug, for example, if it was a $10 copay a month, $30 for 3 months, home delivery would be $15. Yes? We have our own home delivery. We have our own home delivery pharmacies. Optum RX home delivery. No. We have dedicated, this is for maintenance drugs, we have dedicated member services to state of New Jersey. You could reach out, I think, 24 hours a day, 7 days a week to get them. Currently, they don't. I don't know if we're talking about, the question is and I think we're talking about the one that was on the TV, PillPack. I don't know if PillPack per se is a participating pharmacy. Again, and I'll do this in a minute once we break off, you can look up participating pharmacies on the website. You can look up, so it's a good question. If they are in network, you can use them. The likelihood is if they're in network, it's going to be a retail copay, not a home delivery copay. That's just a guess. Anyone else? Yes? If it doesn't have a generic yet, penalty doesn't apply. All right. Okay, sure. The question was, what if the drug is brand only? It doesn't have a generic yet. In that case, there's no generic penalty. It's only for medications that have been out on the market and now have their approved generic also on the market.
Thank you, Bill. And again, you can look at Optum's website. They've got information in there that you can put in the name of a drug and see what the copays are and whether it's covered or not under the plan. So I just want to give you some general reminders. First of all, hopefully everyone here has already signed in. We had a sign-in list. If you haven't done so, then you may want to do that at this time. Also, don't forget, if you're waiving coverage, please pick up a copy of the waiver form. I have those available here. And you're going to need to complete the application and the waiver form and include proof of other coverage. You can submit your application today if you have all of your documentation. If you're just taking single level of coverage, you don't need any other documentation, just the application. And that would be accepted by Gary, who's sitting over here to my right. If you have a child that's over 26 and you need to explore coverage options, let me know. I didn't mention earlier, but if you have a special needs child who's already over the age of 26 today and they're currently covered under your plan today as a dependent, then see me after the presentation because they would have to go through a medical underwriting process. So you can see me after the presentation. And we are going to stick around and answer whatever questions you may have at this point on a one-on-one basis. And I want to thank you very much for coming. We have another presentation at 3 o'clock if you know anybody in your department who hasn't been able to attend yet. And then we'll have additional presentations starting tomorrow at the firehouse and then other locations around the city. Thank you very much.